And there's plenty to smile about this morning. It's Friday, the weather's perfect, and it's also Dental Hygiene Awareness Month. This morning, Dr. Matt Trainer with Cool Smiles is back with some more tips. Thanks so much for being here with us.
Thank you for having me.
And you know, it's not just about the kids this morning, it's also about the parents, because it's important to keep your smile in check, but also your mouth, because that's, how you feed yourself, how you do all sorts of things. So tell us a little more about dental hygiene and why this month is a great time to become aware of this.
Well, this month in particular is a great time to become aware because of Halloween. Halloween, there's a lot of candy, there's a lot of things that can really damage your teeth and start to cause problems in your mouth if you're not careful. And so one thing that's very, very helpful for both parents and children is to remember two things. One, to brush, obviously.
Yeah.
One thing that a lot of parents don't understand for their own teeth is that a hard bristle brush, while it might feel like you're getting your teeth cleaner, actually can cause damage to your teeth over time. A lot of adult patients will come in with a lot of wear on their teeth that comes from a simple toothbrush over many years of a hard bristle going against it. And so a soft bristle brush will be the best thing for both children and parents' teeth to keep their teeth clean.
Not just that, but the hard bristle can also cut your gums, huh?
Definitely.
All right, and what's the next thing?
The next thing is floss. It's probably the most undervalued tool in your house. Dental floss is important not just to get food out of your teeth. I think that's what most people think dental floss is for, is to get the food out that's stuck. But really what it is to clean between your teeth. The toothbrush bristles can't get between your teeth. There's not enough room for that. And so it's important to actually take some floss every day and floss between your teeth, and not just pop it in and out, but actually hold it close to the tooth so that you can really clean each side of the tooth. Most of the cavities that we see between the teeth are coming because they just can't get it clean enough without with their toothbrush alone.
And there's a lot of different diseases that you can actually develop if you don't practice good oral hygiene, right?
Definitely. Gingivitis is the early form of gum disease. That's generally when you get bleeding gums, where they get tender and a little swollen. And then the more advanced form of that is periodontitis, and that's where your gums actually get so diseased that your teeth start to get a little bit loose. And that especially is advanced with people with diabetes, because they have a harder time fighting bacterial infection. They need to be especially careful to be flossing and brushing every day and keep their blood glucose levels in check. All
right, and speaking of diabetes, you were talking about that sugar. Coming up in our next hour, I'm going to ask you a few more questions about candy, why it's so important to stay away from it. And really quickly, how many times should people actually visit the dentist a year?
So it's generally recommended that people visit the dentist twice a year. However, if you have any questions, you're always welcome to come by your local dentist and ask the questions you have. It's important to have a good relationship with your dentist.
Great. Well, thanks so much for being here with us this morning. And Mary, we're going to go ahead and send it back over to you.